going to show you the flow of oxygen. So you're starting over at the compressed gas tanks. You want to ensure that it's over 500 psi. So you're going to unscrew your tank, you're going to open it up, and it'll go through the pressure reducing valve, and it'll go up, and you want to ensure that your line is open. It'll then go up through the ceilings, and it'll come down here, and you just follow it here. It'll come over to your oxygen flow meter, where you would turn it on to choose how many liters you would want to use. So the oxygen goes up and then comes over to your anesthetic vaporizer, where it will mix with your anesthetic gas. And then the two will come over to the unidirectional valve and down your inspiratory tubing to your patient. Then the CO2 and waste gas come through your expiratory tubing to your other unidirectional valve, and then it'll come over to your CO2 canister and take up all the CO2 and take some of the gases out to the scavenge system, and then some of the other gases will come up to your reservoir bag and then back to your patient.
Okay, so for choosing the breathing circuit that we're going to do for Ronnie, she's over 10 kilograms, so we chose the rebreathe system. Based on her weight too, we also calculated that she needs a 2-liter reservoir bag. So what we're going to do, after we set up all the tubing and the reservoir bag, we're going to check the consumables as well. So we're going to make sure that the CO2 granules are not purple. These ones are just slightly, so we can still use it. We're also going to check the levels of the isoflurane. So they should be just at the bottom of the top circle in this little view area. And we're also going to check that the oxygen is hooked up to the anesthetic machine. Okay, for the last part of setting up the anesthetic machine, we're going to do a leak test. So for the rebreathe system, I'm going to take the wide piece, I'm going to include the end. We have to make sure that the oxygen tank is also open and flowing through the machine. So what I'm going to do, I've included it here. I'm going to close my pop-off valve. And then I'm going to use my oxygen flush valve and to make the manometer register 20 centimeters water. So once I have it there, I'm going to make sure that the pressure stays at 20 centimeters water for about 20 seconds. And since it is staying, what I'm going to do, so it's not leaking anywhere, my first step is I'm going to open the pop-off valve. And that's going to allow the gases to leave through the scavenge system. So we're going to make sure that they leave the reservoir bag as well. And then you can just take your hand off the breathing tube. And then that's your leak test.